ma'am.
Morning, Nancy. We're just going to start the session now, Nancy, okay?
All right, that's
We were
fine.
just waiting. So, good morning, everyone. My name's Shazia Khan, and today's session is the assignment discussion session. And it's one of the important sessions to try and get you to work with the assignment and do the assignment, okay? So, before I go into the assignment discussion session, I just want to give you an overview of what we've done in the 4 learning outcomes, so you've got a refresher about what we've done, and then we'll go into the assignment discussion session, okay?
Okay.
So the first learning outcome we looked at was to understand how measurement of health and social care provision informs services. We looked at health-related data. So we looked at changing patterns of things like mortality, infant mortality, morbidity, measures of morbidity. We also looked at the social care-related data, which were things like birth and death rates, data relating to mental health and capacity adult social care. We looked at ASCOF and children's social care statistics. We also looked at the importance of demography, changes in population, age, ethnicity, how demographic data is making predictions. We looked at statistical norms. We looked at what median was, what mode was, what percentages was, and we also looked at reading and interpreting health-related statistics. Why do you think when we look at statistics, why do you think it's so important within health and social care? Data and statistics, why do you think they're so important? Nancy, why do you think data is so important?
Because probably we have to follow up. So
Yeah. Does it find out how many people were in that situation? Like if someone had dementia, how many people had that?
yeah, to have the record of the
Yeah, it has a record and it's really important
to
for
keep the
further
record
future
track.
developments. Yeah.
Yeah.
So then that was learning outcome 1. We then went on to learning outcome 1 was 2, which was to understand the roles and within health and social care practitioners. So we looked at the different roles within healthcare practitioners. We understood the roles and responsibilities. So things like diagnosis, they had to do preventative care, things like, advocacy support. We also looked at the roles of registered nurses. We looked at occupational therapists in learning outcome 2. We looked at social worker, and we looked at the element of responsibilities of social workers. We also looked at general practitioners and pharmacists as well in regards to their roles and responsibilities and what they need to do. We looked at physical therapists, and we also looked at identifying key features of partnership, shared goals, clear responsibilities. And we looked at partnership working, teamwork, multidisciplinary working, and we looked at partnership working, importance of communication, identifying and reducing barriers and understanding boundaries. So that was learning outcome 3. Sorry, 2. We went into learning outcome 3, which was to understand inequalities in health and social care determinants. And here we looked at health and social care determinants in the respect of age, sex, hereditary factors, their health and well-being, some common health determinants such as genetics, environmental factors, social factors. We also looked at the element of health and well-being equalities for different social groups, like maybe race and ethnicity, gender, disability, age. We then went on to look at social class. We also looked at race, ethnicity, gender, geographical region, including like things like rural and urban living. We then went on to look at disability, age, vulnerable groups in learning outcome 3, and also looked at elements of gypsy, roamers and travellers, communities, people sleeping rough, and sex workers. We then went on to look at the influences on health determinants, things like social factors, economic factors, and we looked at environmental factors, behaviour factors, and genetics as well. We looked at the inequalities that can impact on health and social care of an individual, maybe access to education, access to well-being. We went on to learning outcome 4. Hi, are you okay? So I'm just quickly going through the learning outcomes. So the last learning outcome we went through was learning outcome 4, which was to understand the implications of ethical and legal issues within health and social care. And here we looked at the ethical perspectives. We looked at the legislation, Human Rights Act, the Care Act. We looked at GDPR, safeguarding human rights. We also looked at duty of care and confidentiality, why that's so important within health and social care. And we looked at elements of, organ donation. We looked at policies and codes of practice within an organization, especially health and social care, and what are the requirements. We also looked at the framework of British Association of Social Workers, BSW, Code of Ethics, Nursing and Midwifery Council, which was NMC, and the code Royal College of Nursing, RCN, and Principles of Nursing Practices, and why they're relevant. Why is ethics, the principles of ethics, so important within health and social care? So we looked at elements of confidentiality, also patient safety. That was an element of it, and professional accountability, how you are accountable to the, obviously the patient. We looked at duty of care in detail, and also autonomy and paternalism. We looked at genetic engineering and cloning and organ donation. So that was learning outcome 4. I've gone through the learning outcomes quite quickly, so you've got a brief idea of what we did in the last learning outcomes. So now moving on to the assignment discussion session. This is the assignment brief. Okay, it is unavailable on Moodle, and you will have to complete this when you submit your assignment. So your name, your center number, your tutor's name, the unit is there for you, and the word count is up to 3,500. The date set and the date due and the date submitted needs to go in there. So whenever you submit it, your signature would have to go in there, your tutor's signature, and your word count, obviously confirming that it's accurate. So this is the assignment brief. I'm going to go through this in the assignment discussion in your PowerPoints, but I'm just showing you how it looks. So when you're going on to Moodle to have a look at how your assignment looks, this is how it should be. It should say the awarding body, which is Ascentis, and it should say the unit, and the actual declaration should be on there as well. The assignment learning outcomes are on there as well. So what is expected of you in your first submission. So for this unit, it's only a pass or a fail. Okay, tutor's comments and submission. So it goes through the grading profile as well, and the tutor would have to put in their comments in there. So it says performance, pass, merit, or distinction, depending on what element of it you get, you will get one of them. So that would be the element of that. It look at what you'd get for a merit, for a distinction. But the criteria is more for the assessor for this one, okay? So the assignment brief it looks like this, and it is on Moodle for you to look at. Okay, some guidance on the assignment discussion, which I'll stop sharing that, and then let me just go on to the assignment discussion just there. So this is just some guidance that we'll go through again. There'll be repetition, but can you see this? It says guidance, assignment writing guidance. Yeah. Can you all see that, Latifa and Nancy?
Yeah, we can. Yeah.
Excellent. This is available on Moodle for you, okay? And it's just, I will be reiterating this again, but it just tells you your format and your presentation. So every page of your assignment must have your unit name. So you could do that when you insert header and footer, and then it just goes all the way through. You don't have to keep putting it in. Your full name and your unit name as well. Page numbers need to be inserted. Use margins, 1.5 spacing, and a clear Arial or Calibri 11 or 12. Write in paragraphs. Do not use bullet points. And I will go through this with you as well. It needs to be an academic piece of work. It needs to flow. It needs to be full sentences. Referencing and use of sources. The references you need to be using is Harvard System of Referencing. When using in-text referencing, theory, you use like Maslow's hierarchy of theory, you must mention the original author in text. within the bibliography and include the full thing at the source. So example, according to Maslow, 1943, individuals have 5 levels of heads that must be. So this is just an example for you, okay? The one we use is Harvard system for referencing. So you need to be making sure that you are using that and you have a bibliography. Word count expectation. So your final word count depends on the grade level you're aiming for. So for a pass, 3,500 to 4,000. For a merit, 4,000 to 5,000. And for a distinction, 5,000 to 6,500. More depth and more analysis is not just more word counts, okay? Writing based on command verbs, different command verbs, and the types of responses. So explain, define, describe is 100 to 100 words. Assess, contrast, clarify, analyze 150 to 225 words. Compare, contrast, critically evaluate 225 to 400. Don't just define, always apply to the context. And clarify and analyze should be reasoning and breakdown. Evaluate must be judgment, what works, what doesn't, why it matters. And generic, avoid vague statements, avoid link your points back to the unit, use examples, apply theories and practicate real world examples, use evidence to support your analysis, not your own opinion, and don't pad your word count. Quality matters instead of repeating. So this is all available. This assignment guidance is all available on Moodle for you. So you could have a look at this in your own time, okay? Any questions on that? Which we'll go through more anyway, so you've got a bit of an idea. The other one is assignment guidance, assignment brief. Let's just have a look. There is another one I wanted to go. Okay, so another really important one is the malpractice policy. Okay, and can you all see this? It says malpractice policy at the top. Let me just have a look. Let me just get to the top. Just 1 minute, my mouse. Can you see that? It says malpractice and maladministration policy and procedure.
Yeah.
Why do you think this is so important? What do you think it is? What do you think malpractice is? So it's cheating, literally cheating and doing someone else's work. So this is really important because you will sign a declaration. You need to read this policy, okay? This policy identifies that, you know, your work is your own work. You've not cheated. So, you know, malpractice means deliberate or accidental conduct that undermines the integrity of the assignment and certification. So learn a malpractice. That could be you plagiarizing, taking work from AI and copying it, collusion, working with another person and colluding, cheating, the use of AI. So, you know, you need to make sure you are not using any elements of that. You need to make you're not submitting because, you know, once you start doing work like that and colluding, it's plagiarism. And you are signing a declaration saying that the work that you are submitting is your work. So if you're signing a declaration to say that it's your work, is that a contract? Is that to say that you haven't done any cheating? Hi, Mugiraza and Vida. What is that? What is that to say that the work is your own work? Why is it so important to say that work is your work?
Yeah.
That means you haven't cheated.
Yes.
Yeah.
And why is it important that you don't cheat?
Yeah. For
Is
you
it against the law?
Yeah. Yes, and against the policy, you are signing a declaration to say that the work you've submitted is your work. And so, you know, you don't use AI. There is a tolerance level that you can use a little bit of AI, which is below 20%. And that is gone through. So they've got software that identifies what you've used. You know, so you need to be really careful when you do your own work, paraphrase things, you know, make sure you are not copying and pasting things. That's really important. And you will, when you sign the declaration, you are going to say that you have read this policy. So you need to make sure you go through this policy. It looks at cheating, it looks at plagiarism, direct copying from a book. You know, that's someone else's work, so you're saying it's your work. submitted purchased work, that's buying assignments off websites. And I know people that have bought assignments from websites, and the people that they've bought it from, the actual online service, have told us, because I've worked with organizations that do that. So you really need to be careful what you submitted, because you are signing. Appropriate use of AI. Now, AI is all over. It's everywhere in the world, okay? Just avoid using it, okay? Because, you know, you'll read something and it sounds so interesting to you, and then you'll put it in your assignment, and then you get done for AI. So you need to be really careful when you do it. It needs to be, your tolerance needs to be below 20%. It needs to, so you really need to be paid. Collusion, that's, you know, working when learners work together and they cheat and do an assignment, you know, so make sure you're not colluded as well. Disruptive behavior, you know, learn them. And this, you know, there's elements of that you need to follow. Guidelines for learners, the misuse of AI, and learner responsibility, because it's your responsibility, it's your assignment. Now, if they find out that you have there have been any sort of elements of malpractice or plagiarism, you will be reported, and there's a preliminary investigation procedure, stage 1, stage 2, stage 3, and then appeal procedure. So you need to be going through this and having a look at this and how this applies. So make sure you don't use it. That's all I'm saying. Don't plagiarize. If you have read something and you want to put it in your own words, paraphrase things. It's really important. You can paraphrase things. Just make sure you're not using things like Grammarly or AI for things like that. Okay? Is everyone okay with that? Please read the policy, because the policy is really important, okay?
Yeah, okay.
And it's not about, you know, scaring you or anything like that. It's just to keep you on top of things. So because you're signing this declaration, right? The next one, can you all see this? This is just a sample declaration. Can you see that, everyone? So
Yeah,
this is
yeah.
just a sample declaration that you're signing with your name, your student number, your course, and your assignment number. And you are confirming that the work is your own work, and that you've read and understood the guidance on plagiarism. So you tick that. You clearly reference both in text and bibliography, all references, all sources used in the work. You tick that. Fully reference, including page numbers, and used inverted commas for all text quoted from books or journals. You've provided the sources for all tables, figures, data that are not your own work. You have not made use of work of any other student, past or present, without acknowledgement. This includes any of my work that has been previously or concurrently submitted for assignment. And that means, for example, if you've submitted an assignment previously, if you submitted an assignment previously and you've taken something out of your old assignment to put into your new assignment, that is called self-plagiarism. Okay, you are plagiarizing with yourself. So you can't do that. You can't take your own work from a previous assignment and put it in this assignment. That's a form of plagiarism as well. So you really need to be careful. You've not sought or used the services of any professional agencies to produce this work. So you've done it all yourself. It's your own work. And then you understand that any false claim in respect of the work will result in disciplinary action in accordance with the college's regulations. And I've just gone through the college's malpractice and maladministrative policy and procedure that you have said you have signed to, and here you declare it and you've signed that you understood the college's policy on plagiarism, and that you certify that the assignment is your own work, except where you've referenced stuff and where you've followed good academic practice. You need to be using Harvard system of referencing. You need to be making sure you're not copying and pasting. You need to be making sure that you are using your own work, even if it's paraphrasing, instead of taking things out of a book, okay? Because this is really important, because you would go through the malpractice procedure if you copied. You know, it would be in accordance with the regulations of the awarding body and UK Varsity. Has anyone got any questions on that? These are all available for you on Moodle, and samples are available for you as well, okay? So are you all okay with that? I haven't scared you yet, have I? It's all just general that you have to do it. There's no way around it, you know, and it's something that, you know, we know it's one of the requirements of all universities that elements of plagiarism are taken very harshly. Okay, so can you all see these slides now?
Yeah, the healthy and social.
Health and social provision. This is the assignment discussion. There may be some repetition, but we'll go through it, okay? So the learning outcomes for this unit are learning outcome 1, which we've gone through briefly with you. All the learning outcomes is to understand how measurement of health and social care provision informs services. Learning outcome 2, which is to understand the roles of health and social care practitioners. Learning outcome 3, which is to understand inequalities in health and social care determinants. And learning outcome 4, to understand the implications of ethical and legal issues within health and social care. Again, this is the declaration that I've just gone through with you. And there's a link there where it's available. So make sure that you read every part of it, you complete every part of it, and you submit it in accordance to that. Any questions, anyone? No? Ask away. If you need me to clarify anything, just ask away, okay? I think we've got about 5 on. Nancy, Latifa, Mugarizin, and Vida, if you've got any questions, just ask, okay?
Okay.
Useful tips. So read the tasks carefully. Focus on the detail. Make sure you are reading and you are answering the question. Do not change the wording of the question, okay? You are making sure you are answering it and you're focusing what the task is asking you, because sometimes we read beyond the tasks and we go and answer something else. So we've got to be really careful. Focus on command words, broadly, just as the guidance I suggest for action, command words, you can cover the tasks, explain, which I mentioned, assess, compare, and the word limits are all there. Again, the use of Harvard system of referencing. Do you all know how to use Harvard system of referencing?
No, really.
I will show you an app. It's not an app, it's a thing that they put on Google for everyone. You can use Cite Me, you can use Neil's Toolbox, and that will show you how to reference, okay? So, for
Okay.
example, referencing needs to be Harvard. In text, you need to put the author and the style, date and style. So this will be in your assignment. You'll put Slack Johnston, Brandon Jones, 2011 in text, okay? So that's in text. In reference towards the end, you will put all of it. You will put the full reference, what the book name is, what the edition is, where it was published, who the publishers are. Okay, only in text you will put the author's name and the date. Okay. Word limits, stick to your word limits, and this assignment is up to 3,500. Again, plagiarism and collusion, we've gone through that. We've gone through the maladministration policy and procedure and why it's so important. Avoid colluding. Plagiarism is you presenting someone else's ideas, okay? It's not your work. So make sure you are looking at the academic misconduct policy, because when you sign that declaration, this will be part of it, okay? So start of the assignment, you need to include a table of contents. Your font size needs to be 12. We said 11 as well. Calibri Arial, 1.5 line spacing, page numbers to be inserted. And at the start of it, you need a brief. Hello? Yeah.
Oh, sorry.
No, it's okay. At the start of it, you need a brief introduction and make sure you are all putting the assessment criteria as a heading. Do not use bullet points. General information. So because all the units are taught online, the main VLE, which is the virtual learning environment that UK Varsity use and other institutions, is Moodle. Moodle will have everything. It'll have your assignment discussion. It'll have all your recordings of learning outcome 1, 2, 3, and 4. It'll have the guidance for the assignment. It'll have all the policies. It has your assignment writing guidance. It'll have everything, any sort of additional reading, any forms, anything you need to be getting them off Moodle. Moodle is where you refer to all the course material, any sort of additional stuff, any forms you need, like the declaration form, everything is available on Moodle. So if you have any issues or questions, email learnerwork@UKVarsity, but otherwise everything is on Moodle. Study skills. The study skills developed when you're doing an assignment is things like critical thinking, planning, organizing, gathering information, analysis, written skills, academic skills, including referencing and IT skills. So the assessment, all tasks must be done on one document, and it must be Word document, no Google. It must be Word. You must be using Word all the time. Otherwise, your assignment will not get marked if it's not on Word. Assignment brief. So this is the start of it. There's 2 questions to answer. First one, answer both questions. First one, too often a partnership is just a bunch of people from different organizations who just happen to be present in the same room, giving the impression of dancing together while actually standing still. This is a quote from changeuk.net themes partnership work. Now you need to answer this part for this. For an individual who has long-term health conditions and is unemployed, okay, you need to look at this 3 parts to that. The assignment, when we're looking at the assignment, how many parts is there? A, B, and C. Okay? Does everyone understand that? Yeah? So the first one, you would put that as a heading. Okay? You would put that as a heading and write the answer under it. So the first one is to identify the key constitutes that contribute effective partnership. Okay, here you will look at AC 2.2. And which learning outcome would it be? Which learning outcome would it be? What? Learning outcome 2. Okay, so here you will look at, when it says 2.2, that's learning outcome 2. So you will look at here for learning outcome 2, which is to identify the key constituents that contribute to effective partnership working. Okay, that would be looking at learning outcome 2, and the slide is 15, slide 15 onwards. Okay, it would be looking at things like effective partnerships, shared goals and values, clear roles and responsibilities, effective communication, joint decision making. So you need to refer to learning outcome 2. Is everyone okay with that?
Okay.
Yeah. Learning outcome 2, and it would be page 15 onwards. Okay. So the next one, so that's your heading. You would need that as a heading and then explain and answer that. The next one, do not change the wording. The next one is B, which is explain the roles and responsibilities of two health or social care professions working in this individual, with this individual. So here you will be looking at learning outcome 2 again. Okay, you'll be looking at 2.1, which is page 7 onwards. But how many care professionals would you look at?
2.
Anyone? 2. Only 2. So give me an example of who you would look at for this individual. Remember, this individual has a long-term health problem and is unemployed. Who would you recommend that you would look at? There's different ones you can look at. Not everyone will look at the same.
Maybe a GP.
GP, yeah. What
social
about maybe
workers.
a registered nurse?
NHS.
Registered nurse and social workers
occupational
for
therapist?
employment. Maybe.
Yeah. What would you look at in their roles and responsibilities?
NHS.
Sorry?
NHS.
No, what's their roles and responsibilities? What does that mean?
The role of the nurse.
Yes. So you would look at 2 people. So it would be learning outcome 2, pages 7 onwards. Okay. You could look at a registered nurse. You could look at occupational therapist. You could look at social worker. You could look at general practitioner, like you said. You could look at pharmacist, physical therapist. But you need to make sure it applies to this person. So this person is an individual who has a long-term health problem and is unemployed. Okay. So you need to look at 2 healthcare professionals. Is that okay? Do you understand that?
Yeah.
Yeah? Excellent. So the next question we look at is looking at elements of identify one piece of legislation, just only one piece of legislation related to equality, and discuss its impact on service provision in this instance. Which learning outcome is that? C.
4.
You tell
Four.
me which
Four.
learning outcome.
Outcome 4.
4, excellent.
Yeah.
Learning outcome 4. So here you would discuss one piece of legislation relating to equality. What would you look at here? Which legislation? What could you look at?
Equality and diversity, I think.
Equality Act, yes. What else could you look at? What other Human Rights Act? Could you look at that?
Human rights, yeah.
Yeah, you could look at Equality Act 2010. You could look at Human Rights Act. You could look at Care Act. Only one piece of legislation.
Okay.
Okay, not more than one, because then you've got to look at your word count as well. Okay, so here, how many? This is the first part of it. How many parts do you have to the first one? You tell me, and then I'll go through it. How many things do you have to do?
2.
No. How many questions have you got here to do?
3.
3.
3.
Excellent. So this is one heading. Please do not change any wording to make it sound better for you. So this is one heading. You will write that as a heading and you will write the answer under it. Then second one is this one. You write that as a heading and you'll answer it with 2. Make sure you're looking at the red parts. And then the third
Right.
one is you will highlight that and answer it. Each one is the learning outcome 2 and learning outcome 4 that you need to look at. Okay? And you can look at other pieces of work because it's 3,500 words. Is everyone okay with the first task?
Yeah.
Any questions?
Each of them, do they have 300 words?
No, the whole assignment is up to 3,500 words.
Okay. Yeah.
So
All
now
right.
you'll do it yourself, balance it out between both tasks and you'll know then, okay?
Okay.
So this is the second question. There are 850,000 people with dementia in the UK. There are 40,000 younger people with dementia in the UK, and there are 25,000 people with dementia for Black and ethnic minority groups. And that was off alzheimers.org.uk. So you've got how many things do you have to do here?
1, 2, 3, 4.
4.
4.
Okay,
Yeah.
excellent. So you've got 4 things here. So the first one is asking you to discuss the importance of data in health and social care planning for people with different dementia. What learning outcome is it?
Learning outcome 1.
Learning outcome 1, excellent. You're looking at learning outcome 1 and you're looking at page 15 onwards. Okay, it's page 15 that is on, and you can have a look at that. So discuss the importance of data in health and social care with people with dementia. Okay, so things like monitoring and evaluating, things like identifying their care needs, supporting research, resources, policy development. So you'd look at page 15 on the slides onwards. Okay.
Okay.
Do not please change the wording. I keep saying that. B, explain the influences of demography on service planning and delivery for dementia in the UK. What learning outcome is that?
Learning outcome 1.
1.2. And that starts on page 17 onwards. Okay, that will look at page 17 onwards. So you look at age structure. You'd look at things like, geographical distribution, ethical and culture, socioeconomic, health status. You would look at the changes and everything in regards to that. Okay, are you all okay with that one?
Yeah.
Excellent. Then we've got C, discuss the influences and explain the inequalities in service provision in this area. Learning outcome 3.
3. Yeah.
Okay, and here you are looking at what the health determinants, you're discussing the influences, and you're looking at things like inequalities in the provision. So you're looking at geographical, vulnerable people, you're looking at elements of inclusion health, vulnerable groups, gypsies, sex workers, health workers. So you're looking at the element of things in regards to inequalities. Okay, so it could be looking at limited access to education, inequalities in the opportunity to work, It could be, it's looking at pages 17 onwards on learning outcome 3, social inequalities. It could be elements of, people don't have an education, they don't have access to education, they don't have access to employment, that would cover elements of that. Okay, so then we go on to the last and final one is explain the role of professional codes of practice and further discuss the key ethical and legal issues on health and social care. What learning outcome is that?
Learning outcome 4.
Excellent. Learning outcome 4. So you would look at the professional codes of practice, okay, and further discuss the key ethical issues and health and social care, any sort of key ethical issues. That would be looking at the pages 5 onwards, the whole of learning outcome 4, where you'd look at patient safety, resource allocation, health disparities. You'd look at elements of, the setting the standards, professional conducts. You'd look at the element of trying to discuss like informed consent. You'd be looking at elements of duty of care that they have. So these are looking at the role of professional practice and social setting. So you'd look at pages 18 and the whole of learning outcome 4. Ensuring high quality, promoting ethical behavior, guidance on legal issues, professional development, enhancing public trust. So you would look at that in regards to it. So it gives you the... Do not change the wording, please. Okay, make sure you are sticking to that. Make sure you are looking at the wording. So you could do maybe 500 on that, 500 on that, 500 on that, 500 that, 2,000. And then on the next one, you could do 500, 500, 500. That's 3,500. So just balance it between them, okay?
Okay.
Is there any questions, everyone? Make sure you are doing that and highlighting it, doing it like that, and then doing what's it called? Underlining it and bolding it, and then writing the answer. Do not change the wording. Do not change A, B, C, D. Just put it as it is, okay?
Okay.
Okay. Your essay will show wide evidence of research, and it's 3,000 up to 3,500, okay?
Okay.
So timeline and submission, you have 2 weeks to do it from the assignment discussion date, which is today. And you use indicative content and specification as guide to help you structure. The assignment must be submitted on learnerwork@ukvarsity.co.uk. Any questions before we go through assignment guidance? This is some guidance I've put together for you for myself as well, so you have an understanding. So make sure you start with a brief introduction, okay? And end with a brief conclusion. 3-4 lines maybe, okay? 30 words. Make sure you are using Harvard system of referencing, and the online site is one called Neil's Toolbox, and I've put it there for you. If you're using diagrams, please make sure you reference them. Make sure you have a bibliography list at the end, and it's in alphabetical order. Try to use more examples when you're explaining concepts. And when I said have each question highlighted with underline, make sure you are clear on that. And you are referring to the word count and indicative content all the time, checking it. Give proper headings and subheadings. Make sure your work looks presentable and professional. Do not use bullet points in an assignment. That's not an academic piece of work. Referencing should be Harvard referencing and ensure at least 12 to 15 references. Keep a check on your word count, so minus 20% tolerance on AI. Word limit assignment report 3,500, and the grading is an pass or a fail here. Document structure and formatting. Make sure that's all nice and professional. Make sure it's good practice to put the unit number and name. A bit of an introduction, like I said, write out the learning outcome and write out the question and then answer it under that. Again, 12 Arial or Calibri, 1.5 line spacing. When you're doing the questions, you can put the table of contents as well. So you need a table of contents to say where each question is on, and reference and bibliography. Some useful tips, again, read the tasks carefully. People tend not to read the task carefully. Over there, I've put the learning outcomes in where the tasks are and where you can find the information. And you can find the information online on books as well that you need to be referencing. Again, Refer to the command verbs and Harvard referencing as well. Give proper headings. Make sure your document is presentable, and plagiarism. Make sure you've read that report and it's below 20%. You need to make sure you are not copying and pasting your work. As we mentioned, is plagiarism. Make sure you reference all your sources. Make sure you check your grammar and spelling, and it's not American style grammar that you're using. For example, if you use organization, it's not a Z, it's an S. Refer to ebooks and journals on Moodle. Moodle has everything for you.
Okay.
And also, if you're using UK Varsity Slides, then reference would be MDT in text, bibliography, multidisciplinary teams, learning outcome 1, slide number 2 to 10, published on 15th of January 2023. Okay. Do you want me to show you? Has anyone got any questions so far? Any questions, anyone? Make sure you stick to what the tasks are asking you, okay? Make sure you don't change the wording. That's the main things. Make sure you stick to...
Okay.
Okay? I'm just going to show you. Do you want me to show you Neil's toolbox?
Yes, please.
Okay. Now, this is really good because my university students use this as well. And it's a generator, and you don't have to use this. There's other generators around that you can use, like CiteMe and Harvard referencing one. But this one is one that's used by my students, which is really easy. Can you see it there?
Yeah.
It says Neil's toolbox. Can you see him? No? Just see if I can stop sharing this one and share Neil's toolbox now. Can you see that now? Yeah?
Yeah, yeah.
It says Neil's toolbox.
Yeah. Okay.
Yes, okay. So here it would show you how to reference a book, a chapter of a book, an ebook, a website, an email, whatever you need to reference. But we're referencing a book. Let's go to a book, okay?
Okay.
So I'll just put an example there. Book name, health and values. Okay, this is just a book name. I'm just guessing. Brown. Author's surname is Brown. Author's first name is H. Publisher is Sinclair.
Okay.
Place of publish, that will be in the book, is London. Year of publication, maybe 2024. First edition, second edition, 10th edition. Okay, so now, once you put all that details in, you just press generate reference. Can you see it's done it for you?
Oh, okay. Yeah.
Excellent. So it's done it for you. You just copy and paste that into your bibliography, but it needs to be in all alphabetical order, okay? So it puts all the dots and the commas and everything in the right place for you. It's really good to use. You can use it for any of your assignments. Can you see that?
Yeah.
What you will do, you will copy and paste that into your bibliography. Does everyone understand that?
Yeah, yeah.
Yeah?
Use that as an example.
So then if you want to do a website, okay, I'll show you how to do a website. The organization name, it could be Red Cross, okay? Let's put Red Cross. Article, values and principles. Principles. Website name is NHS, let's put NHS. And published 2025, we don't know. Year of publication is 2025. And then you just copy the address from the URL number, put it in that, and you paste it, okay? So now you'll generate it. Can you see it's done it for you?
Yeah.
And you just copy and paste that. Till this day, I will forget this, where the dots and commas are. I've been teaching for 18 years. And I wouldn't be able to put all the dots and commas in the right place. So it's better to use things like this that will help you. And you just copy and paste this.
Yeah.
Okay, so these references, you can reference books, chapters, websites, journals, magazines, ebooks, anything you need to. So use it for all your assignments. You know, it's good if you have another one. There's other ones you could use. but use this one as well, okay?
Okay.
Has anyone got any questions? Let me just go back onto the slides. Right, so these will be all available. The recordings will be all done and available for you. So you've got learning outcome 1, 2, 3, 4 recording, okay? And then assignment discussion recording is available all on Moodle for you, okay? Just make sure if you have any questions or any queries or anything, put email learnerwork@ukvarsity.co.uk, okay? And submission of your assignment must be done on learnerwork@ukvarsity.co.uk, and you have 2 weeks after the completion of the unit, which is now completed. If you need extra time, you can email learnerwork and ask for extra time. If you want to ask any questions or you're struggling with anything, email learnerwork.
Okay.
Okay, has anyone got any questions before we finish off this session today? Please refer to the policy and the guidance. And if there's anything you're unclear about, make sure you're reading the tasks properly and what they are asking you. Make sure you are referring to, the learning outcomes. Make sure you're doing things and not copying and pasting, and make things, make sure you are sticking to the policies and the procedures. Any questions? Anyone? Nancy, Vida, Latifa, Mogarazi, any questions?
Not now, but we're
Not
still
now.
processing.
It's
I'm
what,
still
sorry?
processing.
Yeah.
I'm still processing everything.
Yeah, but start to kind of do one bit at a time, one task, finish one task off, then go to the second task. Don't confuse yourself, okay?
Oh yeah.
It's so easy to confuse yourself, but make sure you do the first task first, because there's 2 tasks, but they've got a lot of parts to it. So this is the first task here. Can you see that? The 3 parts, yeah? And that's the second one, the 4 parts.
Okay, yeah.
Okay? So do that one first, get that out of the way. Make sure you're sticking to what they're asking you, like two healthcare professionals and 1 piece of legislation. Don't write about everything. And then make it clear you're reading everything properly.
Okay.
Okay?
Yeah.
If anyone's got no questions, thank you for attending today's session. Any questions, learnerwork@ukvarsity.co.uk. Again, submission of the assignment on learnerwork@ukvarsity.co.uk. If you don't have any questions, thank you for attending today's session. Good luck with getting on with your assignment, and it was lovely teaching you all.
Yeah, thank you so much.
No, thank you.
Please, are you going to get
Thank you.
you didn't send the link for tomorrow?
We don't have a session tomorrow. This is the last session.
Okay.
Yeah.
Okay.
Yeah, this is because you've done 4 learning outcomes, and this is the assignment discussion. We don't have any more sessions for this one. I don't know
I
if you have
couldn't
any.
join last week, that's why.
Yeah, but you could, Latifa, you could listen to the recording.
Yeah.
Okay.
Okay.
Okay. Any questions, learnerwork@ukvarsity.co.uk. Even if you're confused and you need to ask something quite just a basic question, please email, okay? Because we want to be on the right tracks and get on with the assignment. All the unit, all the Moodle, the learning outcomes and all this assignment discussion will be available and recorded on Moodle for you. Okay, Latifa, Vida, Razi and
Thank
Nancy.
you.
And good luck. And it was lovely
Yeah,
teaching you all, okay?
Yeah,
Thank
thank
you.
you.
Thank you so much.
Thank you. And have a nice week.
Bye.
Okay,
Bye,
bye.
everyone.
Okay.
Bye.
Bye.
Take care. Bye.
Bye.
Thank you, Vida.
Bye.
Bye.